welcome back. It's time for us to go into our communities to look at some of the challenges that we may be experiencing there, and different things are happening. Now, one of the challenges that has been happening since the end of last year is the issue of vaccines, and it's come to a head, in a way, and we're going to be discussing that in a little more detail this morning and show you what's going on around the country. Let's go back a little bit and take a look at some reports from different regions of Ghana showing how there are actually vaccine shortages, even though at a point on this show, a director of the Ghana Health Service actually denied that any such thing was happening.
And that, for some time now, they have been finding it difficult to have access to some essential vaccines for their babies in the Ashanti region. For instance, a mother who visited a health facility for polio vaccine for her baby but was turned away was left frustrated.
My experience is when my son was 3 months, I came for weighing. They told me the polio 3 is shortage here, so I had to wait for 2 months.
And when you came around, with those whose children are 9 months and those who are 1.5, what were some of the things that you heard them saying? What were some of the challenges they face with respect to the vaccine?
I heard them saying it's shortage here, but I don't know. I can't speak for them, but I don't know. But I heard someone saying it, that some is not there, it's not available.
Because after they went inside, they came here?
Yeah, they came here.
Aside from polio vaccines, many parents noted that measles vaccines have not been available at various health facilities. A mother, Memuna Tumumuni, who has been speaking to Citi News, wants authorities to ensure the matter is urgently addressed.
They said next month the vaccine will be ready. So I hope that by next month the vaccine will be ready.
So is it the first time you're coming here that they are turning you away and giving you explanation that they don't have the vaccines?
No, this is not the first time. But I'm now panicking about the vaccine is not here or not. Inshallah, no diseases will catch my child. And we are lodging complaint that we are begging them that they should bring it earlier so that they will inject our child and they will not get ill.
There is shortage of vaccine for routine immunization at the various health facilities across the Bono region. Top on the list is oral polio vaccine. Though officials of these health facilities visited refused to speak on the issue, some mothers who were unable to get oral polio vaccine for their children spoke on the situation.
Me wo ye 40 days ni. 1 month 2 weeks any.
Now buy no mo father no so no say that.
Ye buy ye nya bi. Ye say an hwa ye den pa ye ko ba bia ye say bi ni ho. Nti ye sra ban ni san ko ma bi mra fi say ye nim de aduro ni ye ma mofra no. E bi ni hwa ye nso ye suro. Ti da bia ye friends fo ni bisa wo mo. Omo so say bi ni ho nti ye say ye hu de ye nya mofra no. Ana ye ma me mo wo nso e wo dadaada no. Da bia omo so mo ba nanum na de nti ye penso de ye nya aduro ni bi nso abofra nanum. Nti aban ni nya hu bibi ma ye.
O de ne ba no mti bi wo we no. Mti ba wo abofra no.
Pachai, mutima wone pane no kama pa. Na ye so ye num ne na ye nye bi omo se asa.
Nti de na wo ka cha ban.
The more catch up I say omo pa bimbra na ye nya bi because me ba 1 week no kwampa ma nya bi am so na nti de be catch up I say omo ma ye bi na yeso ye ma no omo nya bi mfa so omo nu.
What me nya pane na wo ma no.
Me pa chwan wo wo no. Me no ni sre ni bankum ni ni fa no ma wo pane no.
Na de we na wanya.
Ni edi so anu na mo anya bia wo e de aso no.
De no mka chi.
Wakache me se ni so na anu no e bi ni ho nti next time ba na mo de bia aso no.
A father, Wisdom Akakpo Tete, who accompanied the wife to the hospital but could not get oral polio vaccine for his child, has this to say on the issue.
Okay, in fact, I'm pleading with the government that he should provide the various hospitals with the vaccine. In fact, I was very surprised to hear that there's a shortage. So the government should, I'm pleading with him that he should provide the hospitals with such vaccines.
Efforts to get authorities at the Bono Regional Health Directorate were unsuccessful.
All right, so a couple of reports there from Ashanti region, from the Bono region, and it's worrying. It's worrying, you know, and I don't think that we should take this lightly at all. At whatever level this needs to be dealt with, and we need to deal with it aggressively and quickly, swiftly. You know, Chris, we've made so much gains as a nation.
Yeah.
Eradicating certain diseases and all of that. And in some of the diseases, we are on the cusp of eradicating. You know, so to be at a place like this, what happened? I mean, how did we come to a place where now it's like, one of the reports said that come back in 2 months.
And that's dangerous.
2 months?
That's dangerous. That's dangerous.
No, it's disheartening.
Because for me as a mother, I actually feel their pain. I feel their pain so much that I'll be so anxious of what will happen next.
Yeah.
Because everybody knows that these our kids' immune system can actually be compromised if they miss any of these vaccinations, and it's just worrying. The question I have is, how are these vaccines managed? Is there not supposed to be like an inventory management system?
Yeah, so that you know that we are running out. We've dropped below. Now we have less than 20,000 vaccines left. So now we need to order and so on. I mean, what's the protocol? And I think we need answers to these questions.
Exactly, because if we just keep quiet about these issues, it's really going to affect parents. It's going to affect parents. It's like parents will tend to spend so much money in trying to, get help for those children that actually get affected by any of these diseases.
Yeah, and just to put it in context a little bit, the idea of a vaccine, the purpose of a vaccine is basically to make sure that we reduce the disease burden within the country. So if you vaccinate someone against, let's say, polio, right? And the polio one now is the drops that they put in their mouth, right? If you vaccinate someone against polio, what then happens is that every time that they are attacked by the polio organism, right, the vaccine that they've taken has created a defense against the polio disease itself, right? A polio infection itself, and make sure that they then do not contract polio, thereby, the various after effects of polio and all of that, And it's the same with all vaccines. So the whole idea is to manage our public health sector. By using vaccines to reduce the pressure even on our hospital systems. The health system itself is not that robust, and so if we are at this point, trying to play catch up, as it were, because we've sort of either slept on duty and not done what we needed to do to make sure that we don't come to this place, whether it's a financial issue, and I suspect strongly there's a financial issue. I suspect strongly there's a financial issue.
Because in one of the reports, it's actually they actually said it had to do with the cities and the dollar issue.
So I mean, I think we need answers. Well, I mean, we'll definitely speak to somebody this morning who can help us. But last week on the Citi Breakfast Show on 97.3 Citi FM, this conversation was had as well. And let me just take a look at this. Yes, on Eyewitness News, the Director General of the Ghana Health Service was called and spoken to about this situation, and this is what he had to say. Let's take a listen to his voice.
There are 3 key traditional vaccines that we have run out towards the end of the year. This is the OPV, that's the polio vaccine. We have the BCG, and then the measles rubella vaccine. We were supposed to procure in the fourth quarter of the year for 2023. But due to the currency fluctuation, the amount of funds that was available in cities could not meet them. So orders are being made now, and we're expecting that within the next 2 weeks, we'll be able to catch up. We know that we have shortages across the country in all those areas, but that's not the situation. So we are working with the UNICEF and our partners to ensure that within the next 2 weeks, we are able to bring in these 3 vaccines. All other vaccines are available.
So just to be clear, the 3 are the BCG, the measles, rubella,
the measles,
and then
rubella,
the OPV.
And then the oral polio.
I see. So where BCG is for which condition? OPV is for polio.
For prevention of tuberculosis.
Mm-hmm.
Yes.
And the measles is measles.
The measles is for measles, and then rubella. That's the one we call German measles.
So if anybody goes for meningitis, diphtheria, tetanus, they would, or whooping cough, they will get.
These are the only vaccines that we have a shortage.
Okay. And how long have we had this shortage?
It started, I would say, we found out around January that we were shorting. So we did redistribution where regions where they have excess distributor whilst we're waiting to address the supply chain challenge. So I would say about 6 weeks. But of course, as the day goes by, the shortages get acute as when we prepare to get the vaccines to be brought in.
Some mothers contacted us and claimed that as far back as June 2022, they had been turned away for one of the 3 you mentioned. So, but you're saying that the situation began in January?
There is always maldistribution in specific facilities. Okay, so that cannot be attributed to because they may have a cold chain problem. They may have had a supply. They may not probably pick their supplies, etc. And so, in all the over 9,000 centers that we run, we are going to have some places, 1 or 2 places, where there may be some shortage, not because there's a global shortage, but because of some logistical aberrations that have made them not to have the vaccine at the time that they were the person needed.
Okay. But in terms of this specific one you're referring to, it is because of exchange rate induced financial shortage.
So you have funds that you're going to buy, it's in cities. Or because of the exchange rate, of course, it does not meet up the amount of dollars you need to pay for that. And so it causes a delay. But orders are being made, and we expect that within the week or 2, it will be flown in, and then we'll quickly distribute.
That was interesting because I thought that the expanded immunization program, a lot of the funding came from one of 2 sources, donor support and also the Global Fund. And I'm supposing that these monies are paid in foreign currency.
There are 2 categories. We have the Gavi supported.
Hello?
Yes, I said there are 2 sources. We have the Gavi one, which Ghana pays a co-fund, which is co-share with Gavi. That is available. There's also the traditional one, which Ghana pays 100%. And that is where of the 5, that's where we have 3 that is short that we are bringing them in.
So for the Gavi one, half of it is paid by external sources, and then we match the funding. But then
we match the funding, yeah.
But the other one is 100% government of Ghana money.
Yes, yes.
Do we know the level of financial outlay or how much the financial gap is for that particular one, the second one you referred to?
The gap. Normally, plus everything, it should be about $3 to $4 million. But you can decide to buy them in the various quarters, and so that's what.
But this $3 to $4 million will be per annum.
Not necessarily. About half a year or so.
Oh wow! So
we've made the necessary arrangements to get stocks in, and quickly as we put in efforts to make sure that we catch up. on all those things. So that is the situation.
Which suggests that we didn't have stock ahead of time, so that when the exchange rate challenges came and we didn't have the money, then there was a shortage. Because if we had stock,
there's always a time within which these orders are made. Vaccines have cold chain issues. They also have expiry. So there's a timeline within which, based on your stocks, you order.
All right. So there you heard the voice of Dr. Patrick Kumar-Boaje. He is the Director General of the Ghana Health Service, of course, speaking to Bernard on the Citi Breakfast Show, which was then replayed on Eyewitness News. And so that's the voice you heard there, explaining the challenges that we have and have had, Chris, it's pretty obvious because I was just thinking to myself, as the initial conversation we had here a couple of weeks ago and was being denied that, oh, there's a real problem. I was asking myself that, wait, hold on. Mothers are almost like gatekeepers of the lowest. It's like they are the ones walking in and having their experience on a daily basis.
Yeah.
So that's where you see if a problem is coming, right? If the mothers, and it's not just one mother, several of them, and they repeatedly, and they keep saying, and it shows up not only in one region, it's showing up in other regions. You're seeing it repeatedly. They say that we went for measles vaccine. They're saying that there's no vaccine. Come back in a month's time, come back in 2 months' time. You already begin to see there's a problem on the ground. And so I'm glad that he actually came out to talk about it and to explain where the position we find ourselves in, and that part of the challenge that we've had is actually this CD fluctuation thing, with the dollar. Because you're buying the vaccines in dollars, and so you don't have the capacity to raise the dollars, then you are short.
Well, I feel like when it comes to a situation like this, the government has to know how important it is.
To prioritize.
Exactly, because of course we the adults can talk about things that affect us, especially with whatever the government is doing.
Yeah.
But the
babies
they
infants
can't talk.
Yeah.
And obviously mothers are exasperated, they're tired, they're exhausted. I mean, after going through the whole 9 months, 360 of having a baby, and now just trying to care for that baby.
Child.
You're stressing them.
And let me just run through this, and of course there are mothers who are watching us, so I mean, there's 6 diseases that are targeted in the initial vaccination by the WHO's program to make sure that the 6 killer diseases are dealt with and eradicated. Measles, polio, which is also known as poliomyelitis, diphtheria, whooping cough, which is pertussis, tetanus, and tuberculosis. Right? So if we are having challenges with dealing with this, we really need to step up, And again, this whole conversation about government and the priorities of government, every time you employ someone at a certain level in government, right, there's a whole bill that comes with that person's employment. The perks of the office, the cars, the vehicles, the helps, the assistance, all those things. And so when we are saying cut down the size of government, it's a big deal, but somehow, we'll see what's going to happen. Let's go take a look. We looked at Ashanti region and we looked at the Bono region. Let's take a look at the Greater Accra region as well as the Northern region.
Over the years, government has depended on external funding through the Alliance for Vaccine Initiative to fund its immunization program. The Gavi model to help member countries like Ghana includes an aspect of domestic funding. However, with the current global crisis, funding seems to be dwindling. The Ghana government, on the other hand, is said to be challenged in fulfilling its financial obligation with reference to domestic funding. Send Ghana, a civil society organization, has been conducting research on immunization funding at the district, regional, and national level, and it reports that There are discrepancies in the allocation and release of funds for immunization.
What we have found out is that, there's a discrepancy between what assemblies allocate for immunization or for purposes of immunization, what actually get released to them, and eventually what is being used for. In as much as the common fund is not common, if it eventually get released, make sure that the funding gets to the Ghana Health Service. We are talking about the IGF. Our IGF base is low, but what percentage of that are we able to commit to addressing issues of immunization? Sometimes the DHMTs just require basic things like fuel to be able to move to address an epidemic situation. For instance, the measles case that we have at the moment, if assemblies are not able to provide that basic resources and DHMTs are not generating, what happens? The situation is going to get out of hand and it becomes a national issue. So assemblies have a role to play, but we are saying that there's the need for deeper collaboration.
Currently, the northern region is faced with measles outbreak. In the midst of the outbreak is the lack of measles vaccines and other vaccines under the expanded immunization program. Here is a mother of a 4-year-old baby expressing concern over the difficulty in accessing vaccine in the Tamale Metropolis and Sanergo municipality.
I started looking for the injection. It's 2 weeks now. Today I even went to the Tela clinic. I didn't get. I went to West Hospital. I didn't get. When I came here today, they say it's not there.
Which one are you taking? Has the baby taken any injections so far?
No. It's the Ghana Mac that we are still going to take. Because we are not yet to 40 days. It's next week that we come for the 40 days.
So since you gave birth, she's not taking any injection?
No. I think the Ghana Mac one will be the first injection, but we haven't yet get that one. So.
And when you came here, what did they say?
They say it's not there. We even asked them whether it will come or not. They say they don't know unless we have been checking.
Stakeholders are therefore urging the government to, like the COVID-19 fund, establish a public health emergency fund to support routine immunization and other epidemics.
We have set up the COVID fund, but public health goes beyond COVID. And so beyond COVID, what do we want to see? We should have a dedicated, pot where there's a funding stream that we can be addressed assured of money, so that when we find ourselves in situations like this, with or without donor support, we can be able to deal with that. Very soon up north, we're getting through the heat season, okay? We are likely to be faced with CSM. And these are things that require resources. And so to the extent that our governments are not prioritizing these things, it's going to pose serious health crisis. So aside committing to the production of vaccines, we need government to dedicate funding, in order that the Ghana Health Service can reach out to the communities. They require the motorbikes, they require the fuel and other logistical support to be able to deliver. Otherwise, as a country, all the gains we have made, especially on immunization coverage, which is over 99% more than the global average, we risk losing that, because that is just riding on the back of donors. So we need government to be more committed in terms of its resource allocation, releases, but also making sure that there's prudent use of resources for addressing issues of epidemics.
Nelly, a nursing mother, tells Citi News her baby missed a polio vaccine last month due to the shortage across the country.
So the Ghana Health Service says that measles, tuberculosis, polio and some other vaccines are supposed to be administered to your child.
She has missed one. That one too, they said they had a shortage and then we were asked to go to the nearest hospital or clinic to get it. But I tried Polyclinic, Kaneshi Polyclinic, so that's the one closer to us. I tried that place too, so they also said they don't have it, so there's a shortage.
Aside from polio, the Ghana Health Service has confirmed the shortage of BCG, a vaccine for tuberculosis and measles rubella. The confirmation is on the back of widespread reports about the shortage for over a month. These vaccines under the expanded program on immunization have been shown to be effective in preventing disease-specific morbidity and mortality. But the service has assured the vaccines will be available in the next 2 weeks.
There are 3 key traditional vaccines that we have run out towards the end of the year. This is the OPV, that's the polio virus vaccine. We have the BCG, and then the measles rubella vaccine. We were supposed to procure in the fourth quarter of the year for 2023. Due to the currency fluctuation, the amount of funds that was available in cities could not meet up. So orders are being made now, and we're expecting that within the next 2 weeks, we'll be able to catch up. We know that we have shortages across the country in all those areas, but that's what the situation is. So we are working with the UNICEF and our partners to ensure that within the 2 weeks, we are able to bring in these 3 vaccines. All other vaccines.
Citi News visited the Greater Accra Regional Hospital Ridge, Kaneshie, Adabraka, and Kolebu polyclinics. Even though managers of these facilities refuse to speak on the matter, some parents say they are forced to move from one health center to the other in search of these vaccines for their children.
Banani de me bless and me konya of fanko. As I'm the warrior, a more warrior, and actually cried the advice son and crying.
I have an old bano.
You know, ridge.
Ridge on them, no, see, be new one, I say.
Miss yes, into me down, me on mobile by him, and me person and corner petting. Yes, see, being you. I made a call fan, call barrier. Oh, na me call you.
And one of them, no, see, it be one.
A honeymoon so I searching as a caba, kuna, a jamudi war my.
Damn, won't ye be on son and unless Miss Uncle and say, ye be funny any penny I want. And it's a man called a for no my day, Maba.
No, ban with how many months?
Only 2 months.
2 months until last month on your vaccine.
Last month when ye be.
This month and so when you be.
This month in when ye be.
When I gave birth, the vaccine that they have to give to my baby at birth, that's the BCG. I didn't get it at the facility that I gave birth to. So they asked me to visit other facilities. Maybe I can get it because there's shortage of it. Yes, I have to roam from facilities to facilities. So I went to Shikura Community Hospital. I didn't get it. So they equally directed me to Mamprobi Polyclinic. Yes, and I went to Mamprobi Polyclinic and I got some there.
Mekwaka the polyclinic, any Eshadai, any Iran clinic, almost say be no. Ain't and them about and Baba try say be a many be Wahanumana, but I still no say Menquajis in the following months, Nakamasamba.
The Health Committee of Parliament and the Pediatric Society of Ghana, among others, have also joined the calls on government to, as a matter of urgency, take all the necessary steps to procure these vaccines. However, these mothers lament the shortage will increase the vulnerability of children to the diseases the vaccines seek to protect them against, hence an immediate intervention from the government.
So you were told to go to some other clinics for the vaccine, and you've been to some of these clinics, but you have been told that there's still a shortage and they don't have the vaccines.
Yeah, exactly.
And as a mother with a 5-month-old baby, how is this making you feel?
Well, I'm not comfortable with it because I think that will have an effect on my baby, something of that sort.
A hard drink, pa. If you say, well, you be a man, it's all you be. A bon impum who buy. Na man, you be into a hard drink. It's all try no more maybe bra.
All right, so there you have it. Different reports from different parts of the country showing the reality of what's really happening on the ground. Months and months have gone by. Parents, mothers have not been able to have their babies vaccinated, and that's a problem. You know, we have different vaccines. We have the BCG, which is for tuberculosis.
Yeah. We have the measles.
We have the MMR, that's the measles, mumps, and rubella. Measles, mumps, and rubella vaccine.
But Kweku, have you walked into the pharmacy and checked the prices of
medications now?
Hey. Like ever since the inflation started, like my pharmacist always tell me, do not get sick.
Yeah.
Do not get sick. And I'm saying this because yes, we know the situation in the country right now. We know the whole financial crisis of everyone right now. Why are we now just quiet about this issue? Because people are crying just to eat. And imagine your child gets sick. Now you have to cry for money to, you know, buy medication and, you know, try to make the child get well and all. And it's just too much. I just think it's too much.
No, I think that, honestly, the government needs to be a bit more serious about cutting down its debt and finding a way to reduce recurrent expenditure, you know, because it's the recurrent, I believe it's the recurrent that really gets you, you know. And if you think about it, government went to the German, to the Germans to say, talk to the Chinese.
Help us,
you know, so that we can sort out this thing and get some credit. But the German ambassador had a very simple response. You want our help? You've got to help yourselves first. You know, let me just quickly read that particular story here, because I think that it's very important to understand that if it's a financial issue, right, there's not much the health service can do per se about, let's say, the inflation rate and all that.
Exactly.
But it gets its finances from somewhere, you know, and if we don't have the culture and the attitude of basically managing wastage and leakage and, you know, spending of money that shouldn't be spent in the way. I mean, you asked the question when we were just playing the report about the COVID fund.
Yeah.
What's happened to the COVID fund?
What's happened to the COVID fund?
You know, and right now, where we find ourselves and how well we've been able to deal with COVID, I think that we need to have a public health fund, you know, that then takes care
deals with everything
of
that
all of
concerns
these
our
things.
health.
You know, because honestly, look, the cut your budget, the German ambassador tells Ghana. The German ambassador to Ghana, Daniel Kroll, has advised the Akufo-Addo-led administration to cut its expenditure and the huge size of government if it sincerely, note that word, needs Germany to help convince China and the international community to agree to a debt relief package. If it sincerely. Ghana has been begging Germany in the last month to convince China to commit to a creditors' meeting to agree on a debt relief package for the country. Addressing the press on Friday, Mr. Kroll said, "It is strange for Ghana to be crying to the international community for help, but continues to operate a government bigger than that of Germany." And that is the problem. We are behaving like a rich country, but you're poor. We are poor. How are we behaving like a rich country? I mean, I'll leave it there. It's on the Republic Press, so you can get a copy of the Republic Press and read the story.
And
look,
you know, I asked you before, why do we even have to wait for the Germans to tell us?
Don't we know?
I mean, we've been saying
this.
Seriously. Like Ghanaians have been saying this for the longest.
Listen, Chris, I had the privilege of going to France and Brussels a few months ago. Traveling through, you see something that's very interesting. There's somebody who has just run onto the train with a backpack. And because I am Johnny Jaskam, I'm passing through, I don't know who this person is. Only to find out that this person is a minister of state. He's going to work. Getting on a train to go to work. It will never happen in our Ghana.
Yeah.
So it's like we spend more money on our daily survival and daily living and just basically operating as a government. We spend more money than those we go and beg from.
And that's pathetic. Like, that is so
It's
pathetic.
unfortunate.
Like, that's so pathetic.
It's very unfortunate. And we are not even embarrassed, bro. That's what even gets me. Anyway, we have joining us on the line the Executive Director for the African Center for Health Policy and Research and Analysis, and that's Dr. Thomas Anaba. Dr. Thomas, good morning.
Good morning to you and good morning to your cherished viewers.
Yes, thank you, Dr. Anaba, for joining us this morning on Breakfast Daily. Just a quick conversation about the situation with vaccines. Where are we at the moment?
Regarding
the vaccine situation, the various protocols that we have, there's been a plethora of complaints among newborn mothers, saying that they can't access vaccines. They go to different health facilities and they are turned away. They are told, come back in a month's time, come back in 2 months' time, and so on. What's the situation as far as the establishment is concerned? Ghana Health Service, our vaccine operators are concerned.
Thank you very much for having me. Regarding the shortage of vaccines in the country, I think it is becoming depressing. Depressing because vaccines are meant to prevent people from acquiring certain illness.
Yes.
That has a very negative consequences in post-infection. For example, tuberculosis can destroy your lungs forever. Polio can make you disabled forever. Measles can destroy your skin, sometimes your eyes. And then, if we don't have vaccine for all this, it means that we are deliberately procuring sickness for our people. Why do I say procuring? It's simply because these are well-known diseases that can be prevented with these vaccines. And it is well established that when you use those vaccines, you prevent the people from acquiring them and prevent a whole lot of complications.
Yes.
Ghana has been procuring these drugs from time immemorial. They know the sources. We plan yearly to procure them for the next year.
Yeah.
We know the population growth. We know the number of women who are pregnant in Ghana and who deliver in Ghana.
Yeah.
We know the neonatal mortality, and we know how much vaccines we need in a year to vaccinate our population. Once you know that, you do a plus or minus and get excess in case the number increases a little.
Yeah.
We don't really understand why Ghana should be without vaccine for tuberculosis for our children.
Yeah.
Ghana should be without vaccination for polio for our children. Ghana should be without medicine for measles, rubella, meningitis for our children.
Dr. Anaba, before you continue, Dr. Kumar Boaji made a comment on one of our shows on radio that the part of the problem was as a result of the dollar situation.
Right.
I don't know if that for you would be good enough as a reason for where we find ourselves.
I think even you yourself asking me this question knows that it is not a good reason, and the people listening to us know that it's not a good reason. Akuma Boaji cannot attribute exchange rate issues to procurement of vaccines. His duty as a Director General is to tell government how much vaccine we need to vaccinate our children every year. He is to tell government how much. He is to let government know that they put money down, ready to procure it in the every time that we are going below our minimum numbers.
Yes.
And government is the one to ensure through the Minister of Health and the Finance Ministry. They know that we don't buy the vaccine in cities.
Yeah.
And they are the ones to look for the money in dollars and put it in that account. Actually, you don't put CDs in that account to buy those medicines. You buy them in dollars.
Yeah.
If you know for your last quarter, you need 2 billion or 2 million to buy vaccines for Ghana.
Yeah.
You put the money ahead of time in dollars. It's lying in our account that this money is untouchable.
Yeah.
And even if you use it, government has contingency funds. The contingency funds are to make sure we cover for the very essential things that we shouldn't miss. So to me, his excuse He spoke like a politician, not as a technocrat.
Right.
It is not his duty to tell us that exchange rate.
Yeah.
Why didn't he tell us the reason why the exchange rate is going up? Why didn't he tell us the reason? He should also come and call him and ask him, why is the exchange rate changing?
Yeah.
Because he shouldn't tread in those grounds. As a technocrat, work as a technocrat. You couldn't buy it because you didn't have enough money to buy it. Then we call the duty bearers and ask them why they didn't give you the money. So you say that no, you had the money, but when you were going to buy the exchange rate this, you are playing politics with our lives.
Right. So,
and that is what we don't want to happen.
Yeah. So, Dr. Hanaba, I have a pressing question now. For the mothers right now who don't have access to these vaccines at the moment, can you give us, maybe, if any of them are listening, can you give us some steps of what they can do to protect their children before they get access to any vaccine? Because obviously you know that these children's lives are actually at stake right now. Yeah. So are there steps that these parents can actually implement to protect their children until they get these vaccines?
The only thing they can do, all these diseases are infectious diseases. You transmit through air, through contact, through water you drink, and the rest. Mothers cannot stop taking they can't stop performing adultery. People will come, they may infest them.
Yeah.
When they grow above 3 months, they may be giving them water. You can't stop giving them water. And we don't have pure water everywhere in Ghana to give to our children, and not all mothers can buy bottled water for their children. It's going to be difficult. You can't tell a child not to walk on the floor where you have tetanus, where you can get tuberculosis. He's learning to crawl. You can't prevent him. The only thing we need to do is to tell government to speed up the process to get these vaccines.
Yeah.
Because the process of transmission of these diseases, you can't prevent it.
Yeah.
You can't prevent people from engaging in that. You can't give birth to your child and lock him in a room. However you lock him, somebody will come to the house, the mother may shake somebody and come and give it to the child. Let me tell you, it's not only mothers now. Adults are crying because we are getting an outbreak of measles in northern region.
Wow.
Measles.
Among the
Terrible
adult
one.
population.
Yeah.
Yes. And you know, tuberculosis, the numbers are increasing. If you check Ghana Health Service themselves, the number of people with tuberculosis is increasing. And now if it's increasing and children are not vaccinated, it means we are going to infect more of our children who will be having lung diseases or impaired lung functions as they grow, which is not good.
Can you help us to understand exactly what the challenge is? If measles cases among the adult population is increasing and tuberculosis cases are increasing among others, what's the challenge? Because that cannot be the vaccine protocol that's being, brought into question here.
It's also the treatment of tuberculosis.
Okay.
Whether all those who get positive tuberculosis are being screened and identified and treated. Whether those who have the tuberculosis get their medicine regularly to take to make sure the 6 months they comply with the treatment and stay without tuberculosis. Whether we are getting resistant tuberculosis in the country as a result of shortages of drugs to treat them.
Okay.
That is now making it transmit very easily and the rest. These are some of the challenges that may be causing the rise of tuberculosis and measles. Whether even the vaccines they are giving are kept in the right storage and vaccinated at the right time to make sure they are efficacious. These are things that we have to ask. And we know the challenges. We know the challenges in some of the rural communities and some of the towns. Life goes off, whatever happens, the vaccine is not transported well or whatever. We have to look into all this to see why adults are now getting illnesses that they used not to get. Young kids are getting diseases that they used not to acquire, and the spread of tuberculosis in the system, as well as the measles that is breaking out. So I think there's a lot of reasons attached to it, but those I've said could be some of the important reasons I can assign to.
Okay, so what about the issue of us setting up a vaccine production center in Ghana. I know there's been conversations about that. The president has been speaking about that as well. Is this something that you feel from where you sit that it's going to be a reality soon? And how much of an impact will that have on the challenges we are experiencing? And also, is it not a little late in the day for us to be talking about this? We should have been we were producing our own vaccines 30 years ago.
Thank you. I think having a manufacturing center for vaccine in Ghana would be a very laudable idea if government actually invests in it. But it cannot be a short term.
Okay.
That is a long-term measure. After 5 years, we can plan from now to 5 years.
Okay.
Before that, let's put the structures in place. You need scientists. You need funding sources. You need market for the vaccines because Ghana is not that big to have a vaccine center. And we can consume all the vaccines. If you want to invest in a very small industry, it will be a waste. You must invest in an industry that can have enough vaccines and have a market for it to be exported. So we need to liaise up with the WHO, with all the agencies involved in the distribution of vaccines in the world so that we can align with them. Because if you go and manufacture the vaccines at a high cost and somebody manufacture it at a cheaper cost, definitely no one will buy yours. So all these measures should be taken in place. For now, we can't rely on that to solve our problem. We need to get money to procure the vaccines currently. Let's work strategically, step by step, to get an industry in Ghana. It would be good if we have it. At least it will earn us some foreign income. It will give employment. It would market the country in the international community. And it is something that if it really comes, I'll be happy. I know 25 million was dedicated to it in 2021 with Professor Mpom Boateng as the head of it. So far, we've heard that they passed a bill in Parliament on it, and it is going to be materialized. We hope that that money they gave to them is used judiciously, and then in the next 5 years, Ghana should not have problems with vaccines. If we can manufacture all the vaccines, at least the major ones that we use frequently in Ghana and the sub-region that we can get markets for, we should be able to market them and then at least protect our people. You know, our hospitals are getting overwhelmed with morbidity. Now, if we add these preventable diseases that were not coming to the hospital rate, if you come with measles and I admit you and then you spread it to other patients, the hospital will get choked up in no time. And now even the health insurance is not working very well. Hospitals are choked up already. So we have to prevent these diseases from occurring and reducing the number of clients who go to the hospitals to make the conditions worse in the hospital. So to me, this preventive measure must be taken up very, very seriously. The government should find the money immediately, procure the vaccines to save our children. Because I won't be happy if my child doesn't get a vaccine and remain a lay person, have a disability in future. It wouldn't be good because we try to stop that. And they cannot, the government should not allow this to happen in Ghana again.
Right. So Dr. Anaba, concerning the adults, you know, getting some diseases like measles and tuberculosis, obviously we know these are diseases that we thought that we have been fighting or have been doing well to fight. But this time around, it's obviously coming back again and it's becoming a problem. What would you advise to us when it comes to protecting ourselves against these diseases?
Right. About the tuberculosis, it has been there, it has been minimized. We can't take it to zero because of malnutrition and all that lifestyle. We go to gatherings, we don't use masks, we don't protect ourselves. People spit anywhere, people defecate anywhere, and then the rest. Hygiene is very, very important in these things. For the measles, it's very contagious. Like chicken pox is very contagious. So somebody has it, touches you, you don't know he has it, he just complains he's feeling unwell. By the time you know, he's having full measles, and you, the one who has contact with him, you pick it. And mostly the adults who will pick it are those probably might have not taken the measles vaccine when they were kids. Or they took it and it was not good, it was not very effective. So they may acquire it. Or if you have some immunosuppression, a lot of immunosuppression, you can also get it. But most of them who get it over adults are mostly those who might have not taken the vaccine unknowingly or took one that wasn't very efficacious. But now we also see children who are taking the vaccine getting the measles. It also shows that some of the vaccines that are being given are not efficacious when they get to the end user.
Wow.
Or
Okay,
they are not handled well before the injection.
Yeah. Okay. So before you leave us, just quickly, referring to the proverbial light at the end of the tunnel, is there light at the end of this tunnel?
I can't say there is no light or else we will demoralize Ghanaians. I'll only pray that government finds the money to help the Director General procure the vaccines.
Okay.
Because if you just tell Ghanaians that, there's no light at the end of the tunnel, it means that everybody should be ready to get measles, tuberculosis and all what is going, polio and then the rest. No, I won't say that. I think there should be light at the end of the tunnel, because whatever resources you have, we have contingency issues. And we have contingency funds. We have emergency situations, and we have an emergency vote or contingency vote, they call it, whatever name the finance minister has given to it. They should dip their hands into that fund, provide the money. Let's prevent preventable diseases. They are called what? Preventable diseases. Let's prevent them. Let's not allow them to fester in our society. So there's light at the end of the tunnel, and there should be light at the end of the tunnel.
All right. Thank you so much, Dr.
Thank you so much, Dr.
Anaba. Yeah, so that was
It's a pleasure talking to you.
All right, it's a pleasure having you here. Dr. Thomas Anaba is the Executive Director of the African Center for Health Policy Research and Analysis. All right, and like he said, let's prevent preventable diseases. Chris, I think we should go on a break.
Yes.
Yeah.